Long before pharmacies and hospitals, humans were already skilled healers. It's easy to imagine our prehistoric ancestors as helpless against illness, but the archaeological and anthropological record tells a very different story. Early humans developed a deep, practical understanding of plants, minerals, and the human body, built from tens of thousands of years of careful observation. This knowledge wasn't guesswork. It was trial, error, memory, and teaching passed down through generations, essentially an early form of medical science. So how exactly did people without doctors, textbooks, or microscopes manage to treat wounds, fight infections, and ease pain? The answer lies in a combination of keen observation of nature, community knowledge sharing. The most basic method of discovery was observation, watching which plants sick or injured animals sought out. Many animals self-medicate, eating specific bitter leaves to expel parasites or rubbing certain plants on wounds. Early humans almost certainly noticed this behavior and began testing similar plants themselves. Over countless generations, communities built up a mental library of which berries caused vomiting, which bark reduced fever, and which leaves helped stop bleeding. This knowledge was refined through direct experience, sometimes at a painful cost, and then carefully passed down orally, often by an elder or a designated healer within the group. Archaeologists have found direct evidence of this, pollen from medicinal plants like yarrow and chamomile in Neanderthal burial sites, suggesting these plants were deliberately gathered. One of the most famous pieces of evidence comes from Ortzi the Iceman, a 5,000-year-old mummy discovered in the Alps. Among his belongings were pieces of birch fungus known to have antibacterial and antiparasitic properties. Tests on his remains show he was infected with whipworm, and researchers believe he was using this fungus specifically to treat that condition. This is remarkable, because it shows ancient people weren't just randomly chewing plants, they were matching specific remedies to specific ailments, a practice that requires real diagnostic understanding, even without any concept of germs or biology as we know it today. Wound care was another area where prehistoric humans excelled. Cuts and injuries were common, from hunting accidents to conflicts with predators, so effective treatment was a matter of survival. Communities used plants with natural antiseptic properties, like yarrow, sage, and various tree resins, to clean wounds and prevent infection. Honey, too, was prized for its natural antibacterial qualities and was used as a protective dressing thousands of years before scientists understood why it worked. Wounds were often bound with softened animal hide or plant fiber, functioning much like a modern bandage. This wasn't primitive guesswork. Many of these treatments are now recognized by modern medicine as genuinely effective antibacterial qualities. Beyond physical remedies, early human communities also relied on specialized individuals, often called shamans or healers, who held deep knowledge of medicinal plants, rituals, and the human body. These healers weren't simply mystics. They were the closest thing prehistoric society had to trained physicians. They understood dosages, seasonal availability of remedies, and how to combine treatments for greater effect. Ritual and spirituality were often intertwined with treatment, partly because illness was poorly understood, and partly because the psychological comfort of ritual likely had a genuine calming effect on patients, something we now recognize as a real, measurable part of healing. Fever, pain, and digestive issues were treated with an impressive range of tools as well. Willow bark, which contains a natural compound similar to aspirin, was chewed to relieve pain and reduce fever. Certain mosses and lichens were used for their mild antibiotic properties. Fermented plant substances may have been used to help with digestion or wound cleaning. Archaeological sites across the world, from Europe to Africa to the Americas, reveal strikingly similar patterns of herbal use, suggesting this knowledge developed independently again and again wherever humans faced the universal challenges of injury and disease. Of course, prehistoric medicine had serious limits. Without an understanding of bacteria or viruses, treating deep infections, complex fractures, or contagious disease was often a losing battle, and life expectancy reflects that harsh reality. But dismissing this knowledge as primitive misses the point entirely. Early humans built a genuinely functional medical system through patient observation, careful testing, and generational memory, one that kept communities alive long enough to pass on both their genes and their hard-won wisdom. Modern medicine didn't emerge from nothing. It grew directly from this ancient foundation, and many remedies discovered around the campfire thousands of years ago are still studied by scientists today, proving that our ancestors were far more capable healers than we often give them credit for. Oh, the next time you drizzle honey into your tea without a second thought, spare a moment for the countless early humans who got there first, with sticky hands, watering eyes, and a few unfortunate stings to show for it. It's a small, sweet reminder that some of humanity's oldest habits weren't really about survival at all. Sometimes, then as now, it was simply about wanting something delicious badly enough to risk getting stung for it.